National Public Health Week, reflecting on progress, inspiring the future. I'm Laura Magaña, President and CEO of ASPPH, the Association of Schools and Programs of Public Health, and it's a true honor to serve as your moderator today. At ASPPH, we represent more than 155 accredited schools and programs of public health, united in our mission to advance academic public health by strengthening education, research, practice, and advocacy. Every day, our member institutions educate the next generation of public health leaders, generate evidence to inform policy and practice, and work to improve health outcomes in communities across the globe. ASPPH has proudly supported National Public Health Week, one of the most important annual moments for reflecting, celebrating, and action in our field. Since its inception by the American Public Health Association, National Public Health Week has reminded us of the critical role public health plays in building healthier, more resilient communities. It's a week that not only honors how far we have come, but also galvanizes us around the challenges and opportunities ahead. This year, that reflection feels especially urgent. We will find ourselves at a critical crossroads. Public health departments and institutions are still recovering from the immense pressures of the COVID-19 pandemic, even as we face significant funding and staffing challenges. These are undeniably challenging times for our field. Yet, public health remains as essential as ever. That's why today's conversation is so important. Together with our partners, we continue to advocate for sustained investment, innovation, and health for all. We know what's at stake, and we know what's possible when we work together. We are especially proud to work in close partnership with many of the organizations represented on today's panel, including APHA, ASTO, and of course, ASPPH members, all of whom have been at the forefront of leading, shaping, and responding to the evolving public health landscape. Today's conversation is both a celebration and a call to action. We will reflect on the remarkable progress made over the past 30 years, discuss the challenges we're facing now, and explore what lies ahead for public health as we look to the next 30 years. Before we begin, please use Zoom's QA feature to ask your questions. Towards the end, we will have an audience Q&A session. So with that, it is now my pleasure to introduce our esteemed panelists today. Dr. Georges Benjamin, Executive Director of the American Public Health Association and a key figure in establishing National Public Health Week. Dr. Hilary Godwin, Dean of the University of Washington School of Public Health and a thought leader on public health preparedness and equity, and ASPPH Board Chair. Dr. Joseph Cantor, CEO of ASTO, and a leader in state and territorial public health strategy. Thank you all for being here today. Let's begin with opening remarks from each of the panelists before moving into a moderated discussion followed by an audience Q&A. Dr. Benjamin, let's start with you, please.
Thank you very much, Dr. Magna. First of all, I'm going to just thank everybody and say Happy National Public Health Week. And to remind us, it's been really 30 years since National Public Health Week was officially designated by then President Clinton. But like many things, there is a history. And some of you may not know that National Public Health Week was inspired by the old Negro Health Week. While there's probably not a real direct connection between the two, it was certainly an inspiration. And in the early 1980s, this kind of need to be celebrated, to try to bring visibility for the work that we do, began being discussed at the American Public Health Association. And then, of course, Dr. Cass Evans, who was then the president of APHA, actually conducted the first National Public Health Week in Los Angeles County, where he was health officer, and then, had a proclamation for National Public Health Week. And then over the 90s, as many as 20 states independently also began to recognize National Public Health Week as an important week of celebration. And that ultimately led to a meeting in the HHS with Dr. Phil Lee, who then was Assistant Secretary for Health, and then ultimately a presidential declaration for National Public Health Week. So at the end of the day, this is about visibility, this is about celebration. And even when times have been tough, as they are now, it's been an important week for us. So again, let me just thank you all for what you do. And again, happy National Public Health Week.
Thank you so much, Dr. Benjamin. Dean Godwin.
Yeah, hi. As Laura mentioned, my name is Hillary Godwin, and I have the pleasure of serving both as Dean of the University of Washington School of Public Health and more recently as the new chair of the ASPPH Board of Directors. It's a privilege to serve in both of these leadership capacities at a time when public health is both in the crosshairs and is needed more than ever. And I'm thrilled to be here today to help set the stage for that work. One of the most important pieces of work that we need to tackle collectively in the months and years to come is to take back the narrative around why public health is essential and the value that we bring to communities locally, nationally, and globally. We cannot let individuals who have competing values and priorities define how the public perceives our work. National Public Health Week is the perfect opportunity to highlight the accomplishments of public health over the last 30 years. Many of these, including progress in vaccine uptake for preventable diseases, occupational health and safety, childhood lead poisoning prevention, maternal and infant health, preparedness and response to climate-related disasters, and reductions in HIV transmission, are currently under threat. In addition, the infrastructure that's been responsible for the development and implementation of new public health interventions in both public health practice settings and academic institutions is being dismantled at a scale that has not been seen in any of our lifetimes. As public health professionals, we must figure out how to meet people where they are, understand their concerns, and communicate effectively about what we're doing as a community to address their needs. I'd like to take the moment to give a shout out to the ASPPH communications team, who have put together an outstanding messaging guide, and I'll put the link in the chat, that member organizations can leverage at all times, but particularly in this moment. Right now, using a consistent messaging strategy that's evidence-based and speaks to individual audiences to show we understand and can support their needs is absolutely essential. We also need to develop effective strategies to broaden the tent and partner with individuals and sectors that we haven't traditionally reached as strongly. In an era where some public health services may shift from government agencies to the private sector, showing up at the table with corporations and listening to their concerns will be absolutely essential. In addition, ensuring that our graduates have the skills and competencies needed to be career ready and successful in the private sector, in addition to government agencies and academia and nonprofits, will be increasingly important. None of this is easy, but I'll say none of the work that we engage in public health is easy. I found throughout my entire career that the people who are in public health are scrappy and resilient. They are committed to the work of public health because the world needs them, needs their vision, and needs their passion. And that's never been more true than today.
Thank you so much for those words, Dean Godwin. So, Dr. Cantor.
Thanks so much. I couldn't say all of that any better myself. Let me introduce myself. I'm Joe Cantor. I have the pleasure of serving as CEO of the Association of State and Territorial Health Officials. We support the work of health departments in states and territories across the country. To acknowledge current events, as was mentioned, it's been a very challenging few weeks in public health. There's no question about that, and there's no need to sugarcoat that. But I think it is important to take a step back, particularly during this week, and acknowledge that for those of us that work in public health, either in health departments or in academia or any associated endeavors, the work you do really matters. the work you do really has an impact on people's lives. Sometimes that's not obvious, and that's part of why Public Health Awareness Week is so important. Time to reflect on that. But the work you do is extremely important. One of the great joys of my job now is I get to talk directly with staff and health departments across the country and learn about the work that they're doing on the ground, and how it's improving people's lives in ways that they often don't know or don't realize. It's easy to lose sight of that. It's particularly easy to lose sight of that when you feel like current events are coming at you fast, as they've been the past couple weeks. But we have so much to be proud of in this profession. This is a profession built on altruism and excellence and evidence. And those are things that I will hang my hat on any day of the week. So please know that the work you do matters and people really depend on it, whether they know it or not.
Thank you so much. Thank you so much, all of you, for this really powerful opening reflections. And now let's go to the more deep conversation in terms of some of the topics that you have already touched on. So let's start with some conversation among ourselves first. And then, of course, I remind everyone that you can send us your questions in the Q&A box. So, Dr. Benjamin, in light of the recent federal cuts to public health funding, what are the most immediate risks you see to the nation's health systems, and how should we respond to them?
You know, the challenges we have with both the funding cuts and the personnel cuts is that we're losing capacity rapidly for a comprehensive public health system. As you know, our public health system is a federal, state, local partnership for both government and non-governmental entities, and it's coming apart in many ways. But I think the biggest issue here is the complacency of the public, the fact that the public does not know that public health saved their life today. And so I think one of the things we've got to do very clearly is help people connect the dots, make sure they understand the value of public health and what they're losing by the loss of its infrastructure. I think that's probably the thing we ought to be pushing the most. It's not just being visible, but it's also being visible and telling people what the issue is that they're losing.
Absolutely. Thank you for reminding us that. I think two key questions here, to be visible, but also to change the narrative in order for the people to understand what they are really losing. So, Dean Godwin, you're representing here the academic public health, and you talk about the importance of our students and our graduates to have the competencies needed to really face the current times. So how might public health schools evolve their curricula to reflect really the changing landscape of health challenges?
Yeah, two immediate things come to mind. They're not things that are new. I think they're just things that require perhaps us to pivot under the circumstances and to reinvest our energy in them. The first is around communicating to diverse audiences. We have, for many years, focused our training on cultural competency and are proud of the fact that we're training graduates who are culturally competent. What is clear to me is that despite those efforts, that we are not reaching a substantial segment of our society with our communications and messaging in the way that we would like to. And so I do think that some renewed commitment to training our students around dialogue across differences, around engaging in critical conversations is definitely needed in this moment. And it's hard to do when we all feel under attack. So I say that knowing that this is a hard thing to take on, but I think really necessary. And then I would say the second area that most readily comes to mind is making sure that, again, it's not something new for us. We've always been committed to making sure that our students have excellent data analysis skills. But I think making sure that we are watching just the incredibly rapid pace of change in terms of data science and tools like large language models, and really thinking about how we can make sure that our students are emerging with the skills that they need to do work that they've always been doing, but to do it more efficiently and effectively in ways that will hopefully prevent burnout once they get out into the workforce. And also that they're able to leverage those new tools to be able to do things that we couldn't have imagined doing 5 years ago. So those are two of the ways that I could imagine us sort of keeping our eye on the future.
No, absolutely. Thank you for the reflection, Dean. So, Dr. Cantor, what can we do, following a little bit of what the reflections from Dr. Benjamin, what can we do to strengthen the case for long-term stable funding for public health at the state and local levels?
I mean, it's a big challenge. You know, we've been victimized by this kind of boom and bust funding cycle for many, many years where funding gets cut, it's low, there's some emergency, Congress reacts probably a little bit too late, funding comes when you're halfway or 2/3 of the way through a response and then lasts after. That's been the reality for many years now. And it's, if you think of public health in terms of stability and security, in terms of national security, that's not the way that we fund other auspices of national security. It's not the way that we fund the police department and the fire department and other agencies that protect your health and your family's health today. I think one way that we can help advocate for more stable funding is to do a better job of painting a picture in people's minds of what public health is doing. Same thing that Georges and Hillary both alluded to. Connect the dots directly to people. Let them know what public health is actually doing behind the scenes. Often, I think coming out of COVID, the reality is if you stop someone on the street in a random town and ask them what public health did, decent chance their answer is going to involve masking and vaccines and things connected to COVID, right? And that's like 0.0001% of what public health is. So I've been really keen on my end to try and highlight where I have opportunities to do so tangibly. What is it? Let me give you one example. I live in New Orleans and I work clinically as an ER doc in New Orleans in the trauma center here. We like oysters in New Orleans. I like oysters. There is a small risk of eating oysters. There's a bacteria called Vibrio that can cause a very serious infection if they're not handled properly. And every now and then you see a case here and there of Vibrio. I've been thinking about this a little while. I was working clinically maybe a month and a half ago and had a patient that was sick after eating oysters. He was in from out of town and we suspected Vibrio and were able to preliminary confirm that. And with one call to the health department, that triggered a reaction where a team went out to the restaurant where he ate and tracked the oysters down and pulled those from the fridge of that restaurant. A separate team went out to the docks in the Gulf and actually spoke with the harvesters that harbored that oyster, pulled those batches, and then investigated the water quality in the specific area of the Gulf where those oysters were harvested from. And the end result of that is potentially dozens, if not hundreds, of additional cases of Vibrio were prevented. A whole industry in New Orleans that's built on tourism and restaurants was able to function well. The economy wasn't affected. And more importantly, less people got sick than would have otherwise. And all of that happened in the background and no one knew about it. Those are the stories I'm really trying to highlight because they're happening all the time, every day. People's lives and businesses are dependent on it, and not enough people know about that.
Thank you for saying that, because one of the discussions that we're actually taking place right now in ASPPH is that we really need to collect the stories, the thing that makes people really realize, the impact of public health actions. So you are really telling us a great story, and those are the stories that we want to start collecting in order to really talk more about the impact of public health action, so people would know what do we do and be more visible, as Dr. Benjamin was saying, but not just visible, but just what's the impact of the everyday actions or inactions of public health in terms of population's health. So thank you for sharing that story. So going back to Dr. Benjamin, looking back over 30 years of National Public Health Week, what do you see as its most enduring impact on the public's understanding of public health?
I think we've grown a lot. I think the public health community have spent this week as celebration. But I think one of the things we've not done is we've not really put the public back into public health. It's still a celebration amongst ourselves. And I think one of the things we've got to do is figure out how we engage the public in a more active way so that they see this week as something that they celebrate, certainly during, National Public Health Week, the first full week of April, but also that they see this as some way to celebrate it 365 days a year. So that as Dr. Cantor said, when people get up every day, they say that, I benefited from public health. Even if it's in an unconscious manner, that they know that they benefited from it, so that when they see a threat to public health resources, they recognize that it does impact them.
No, absolutely. And a great point to make, as you were saying, is that, we tend to talk to the choir and we stay in our own silo. So I think it's time really for public health to start really including the non-traditional partners, the non-traditional audiences, and start really our new narrative in order to engage all of them. We know right now what's really on stake, and we really need to react fast in this way. So thank you for reminding us that. So going back to you, Dean Godwin, and I'm glad we're starting to see some of the Q&A questions that really relates to our schools and students' concerns. But before we reach them, and I would like you to start looking at them, how can academia better support our students, not just in the technical training, but in preparing them to really to lead in politically and socially complex environments?
Yeah, one of the things that has been a topic of conversation amongst the deans and program directors is how we can leverage our network of schools and programs that are in really diverse political settings to be able to provide better training for our students. And so one of the things that I've been talking to some of my colleagues about whose schools are in states that have very different political contexts is how we might get their faculty and staff together with our faculty and staff and talk about communicating across different political perspectives, and also learn from what some of the states that have already been experiencing statewide legislation that's similar to what we're seeing on a national scale, how we can leverage some of those learnings. And I would say Washington is a great example of where we need that within our own state. So a lot of our graduates end up staying at the university in Washington State, but we're not just, we often say we're a purple state because our color is purple. But the reality is we're a blue state and a red state that live together. And we need to be making sure that we're training our students to be successful in terms of how they talk about public health, how they engage with stakeholders, regardless of whether they end up staying on in the blue part of the state along the I-5 corridor, or whether they end up going out into the redder parts of the state. So I think there's plenty of opportunities there and lessons to leverage each other's expertise across the membership group.
Excellent. I think you're talking or emphasizing one topic that we constantly talk about academia and public health, and that is all these competencies that our graduates, our students need to have that are more than technical, is more than knowledge, is really, the professionals, the cross-cutting competencies that deals with how do we interact with others, especially with the ones who maybe not necessarily think the same as us, and even, contrary to what we believe. And it's extremely hard for us to really interact with them. But now more than ever, we need to really know how to find the common grounds. Our students, our graduates have to have the competencies in order to really communicate to different audiences, as you were saying, and also to reach consensus about important issues about health and well-being. So now more than ever, all these competencies, the cross-cutting competencies, the human competencies, the non-technical, the more than that are extremely important to emphasize in our curriculum. So thank you for reminding us that, Dean Godwin. So going back to Dr. Cantor, what lessons have state and local health departments learned in building stronger public health trust during emergencies? Because I think that we all talk about a mistrust right now in the public health system. So how can we regain the trust of the public?
It's a great question, and it's a really robust conversation right now. I think, looking to be fair, I think it's going to take a lot more time to really piece together how we advance here. I'll tell you where I've gotten to on my end from my own experiences leading a health department and from talking to many other health officials across the country. First is the manner in which we communicate. I think there's a real sense that you have to be real with people. You have to be real. They have to have a sense that you're not putting on an act, that you're being genuine. So, the conventional wisdom going into COVID on public health crisis communications was be first, be right, be credible. And that stemmed from the CDC's excellent publication on public health crisis communications that came out before the pandemic. And I think those are really strong points to do. On the last one, on the be credible, I think there is a tendency that some might take to, in aims of being credible or appearing credible, to shorten an answer, to cut out nuance, to be more succinct, and make the evidence seem less nuanced than it perhaps is. And particularly as we realize in COVID, for something that's novel, that we're learning every day, that none of us have lived through before, we get some things right, some things we learn more about, we adjust our recommendations. That is science. That's a scientific process. If I could go back in time to my own communications, that's one thing I would change. I would have delivered more nuance, taken more time to explain this is what is known, this is what is not known, this is what the collective public health community is doing to try and figure out the unknown questions, et cetera. I think in hindsight, that would have been worth my time to explain that. The other lesson that many of us have taken away is you have to make communications accessible to people. You got to be communicating with people where they're comfortable getting information and where they're receiving other information. I can tell you from my own experience in my own department that I ran, coming into COVID, we communicated in kind of a very uptight way. We put out press releases, and did press conferences, very buttoned up. And that's not where people get a lot of their information. And through the pandemic, we learned if you want to reach a lot of people, you got to go where they are. You got to go on social media. You got to put out videos. You got to do interviews. You got to go on podcasts. And a lot of departments are doing that now. Folks that are on the other side, folks that are pushing an anti-science agenda, figured this out a long time ago and are very good at it. I think we in public health need to be more comfortable expanding the platforms and really taking the message wherever and whenever we have the opportunity to take it to a place.
Absolutely. Thank you so much for that. I don't know, Dr. Benjamin, if you want to add to the same topic of trust. You already covered a lot of issues, and thank you for that. But do you see other ways to also build on this topic?
I think Joe's right. We talk about trust being gained in drops and lost in gallons. And to that end, long-standing relationships are very important. So the challenge we have as public health practitioners is that in many cases, we're viewed by the community as faceless bureaucrats because they don't see us every day. We don't have uniforms. We don't have big red trucks. We don't have little blue cars with sirens. And so we come out of nowheres, and we come out of nowheres giving them advice or guidance or putting our regulatory hat on, and they kind of don't know where we came from. And so I think that one of the things that I learned early on in my public health career is that you got to spend some time in the hood. You got to get out and meet folks. You've got to have your staff that's out brokering relationships so that when they see you in a trusted manner long before you're having to give them advice that's tough or requiring them to do something or asking them to do something that will protect not only themselves, but their family members, so that they understand your motive is pure, and that you're not self-motivated. It also shields you from those people that would want to do you harm from a reputational perspective. And because people already know you, they already trust you, and they don't necessarily trust those or know those other people. So it gives you a leg up.
Absolutely. Thank you. Thank you. Thank you for adding those important aspects. So, Dr. Godwin, what strategies have proven most effective in creating more equitable and inclusive academic environments in public health, especially in these challenging times?
Yeah, thanks for asking that, Laura. You're giving me an opportunity to do another advertisement for some of the projects taken on by ASPPH and its members, which folks can find on the website, but I'm sure someone from the ASPPH team will put in the chat as well for folks. We have had a number of task forces working on really critical questions across ASPPH. So it's bringing in folks from all different schools and programs and working on critical topics. And this is one of them. And I want to highlight that the ASPPH has a great document called Building Inclusive Excellence Through an Anti-Racism Lens. That is the output of a fantastic task force, and they give very specific strategies. And ASPPH and the Robert Wood Johnson Foundation are also working with a series of different programs and schools on implementation strategies for that. So rather than go into the details of the report, I'm going to emphasize that it is available to folks and that they check it out. One of the things that my predecessor, Thomas Leviste, and I agreed upon was that as chairs, we would focus on trying to disseminate out the important work products that have already been developed by members through ASPPH. This is one of them. I would say another one, as long as I have the platform. Another great example is there's a great report around how schools can implement educational goals around climate change and health. So that's another one that I would say. So probably not exactly what you were hoping for in terms of an answer, but a little advertisement there.
Awesome. Thank you so much. No, thank you so much. And I will ask actually our staff to actually put on the chat all these resources that you can find, of course, in our webpage, but yes, for you to look at them. So thank you for reminding us of those materials that we already have. So I would like to move us into a little bit of different topics at this time. And again, remind the people, the audience to send us your questions. In a moment, we will gonna go to answering those. But before we do that, I would like to pose a question to all the panelists, so please feel free to answer in any order. So these are challenging really times for public health and for all of us. How do we sustain energy, hope, and leadership among students, practitioners, policymakers, and actually among ourselves? Anyone can start answering that question.
I always start by telling people that you always need to have some little me time. You need to figure out what makes you happy, and you need to spend some time doing it. And you need to carve that out. You need to proactively carve that me time out. Because we're all busy. We have family members, we have spouses, significant others that we have to, pay attention to. We have job responsibilities. But in our 80-hour a day, week jobs, we've got to find some me time. So I encourage people to, find some time thinking about what they like to do, thinking about what they don't like to do. Don't do the things they don't like to do, and do the things they like to do. As a priority, as part of that, and recognize that, yes, there are tough times, but there are people fighting for them, and that this is not a time to be afraid. This is a time to recognize that the value that we bring to the table.
Thank you so much for that.
I agree with everything Dr. Benjamin said. I would add, not only are these tough times, these are incredibly unique and impactful times. And not everyone within their professional life, professional career has the opportunity to work in an area or a time period where their entire profession is being dissected and the future is unknown. But in that unknown is real opportunity. That's the way that I look at it. I don't suppose if you're a professional athlete that you train specifically with a losing season in mind. You train to be in game seven, right? This is game seven for public health right now. I mean, everything's on the line, and there's incredible opportunity and potential impact in that. That's what keeps me going, is knowing that so much is malleable right now. And the work that we're doing now, how we respond to the threats that are many, how we position the resilience that we have, the stamina, that's going to have monumental impact on what public health looks like 10 or 20 years from now. So that to me, that's an opportunity, and that's what gets me up in the morning.
Thank you. Thank you so much for that.
I love both of your answers, so it's a little hard to go last here, but and would agree with everything that all of you said. I would add perhaps something that I've been focusing on with my school and leadership team has been carving out time for sense making, collective sense making, and for substantive conversations. That it is very easy in this time of a lot of things coming at us to get overwhelmed. I think we all have been in that. It's like this roller coaster ride. And so just as, public health teaches us about, taking care of ourselves, I think that also they're really important lessons around how we nurture ourselves as social beings and preserving those relationships both at home and at work. I think is in these times is really important and requires a lot of intentionality. It's one of the things that I love about ASPPH. So I'm glad you're making space for us and Public Health Week. So you're making space for all of us to come together and celebrate the work that public health does. And I would just echo what Doctors Benjamin and Cantor said around what absolutely keeps me going is knowing that the work of public health is needed more than ever. And so it is hard. It is hard to deal with all of these things that are coming at us for all of us, but knowing that the work that we do is so important and so needed is one of the things that keeps me going.
Thank you so much for those insights. Extremely important to remember our why. Why are we doing this in an everyday basis? So thank you for all your insights. Maybe the last question from me to the panelists in terms, just to cover another topic before we go actually to the questions of the audience. And this has to do with the decision makers. So how can we better communicate public health's value to decision makers? And actually, we already talked a little bit about the public, but so I would like to concentrate now in the decision makers, right? Especially when the impact is often really long-term and preventative. So how do we do this work?
I'll go ahead and jump in first. I think for most people, you have a much greater opportunity to relate to, interact with, and impact the political system than you think you do. And I didn't realize this until much later in my public health journey. But elected representatives, whether they're in the U.S. Congress or whether they're in your state house, they've got whole teams of people whose job it is to answer the phone and talk to constituents. And, my experience and the experience of friends and colleagues, family of mine has been, even if the elected official is of a political ideology that you don't agree with, the people on the phone are usually happy to talk it out and actually sometimes can be very engaging conversations. And all of those conversations get reported up to the elected official. They tally these calls. It really does make a difference. And it makes a particular difference in your state elected officials, your state representatives. There's a ton of public health policy coming through state houses right now. Some of it good, a lot of it terrible, a lot of it terrible. And your state elected officials are malleable. It does not take a lot to sway them one way or the other. Less entrenched than in Capitol Hill. If you spend the time, build a relationship with particularly your state official, you can really be impactful on a lot of these public health bills. It takes time. Call them a couple times a week, get to know them. Again, they pay people to answer the phone specifically for this purpose. If you're not doing that, I guarantee you, there's somebody who has a different viewpoint than you that you might not agree with who is. And their voice is being heard and yours is not. And it costs you nothing. 5 minutes a day, a couple times a week.
Well, thank you for those suggestions. Dr. Benjamin,
No, I just agree with him. I don't have any more to add.
Thank you. Thank you.
Okay. Yeah, so just to 100% echo that, and give a shout out to the Washington State Public Health Association that runs a legislative education day for public health once a year. We just passed it, but plenty of time for all of you out there to find out when your state's next session is of that and to connect with your local health association. I consistently hear, to emphasize what Dr. Cantor said, consistently hear from our representatives in the state legislature, and can just visibly see it. They are so excited to hear from students. They're excited to hear, if you're not from that state originally, go and talk to the representative that represents the district where your institution is located. But if you're originally from the state, oh my goodness, go see the representatives for the district where you grew up. They care deeply about what you have to say and absolutely want to hear from you.
Thank you so much for all of that. And thank you, the panelists, for responding individually to the questions in the chat. You have been really very successful in that. We still have a couple of them, and then I really encourage the audience to keep on sending us your questions. I know that the panelists are answering them, but also we would like to answer some of them for everyone. So, for example, there's one right here that talks about as public health students, and I can see from the questions that we have students in the audience, and of course they are concerned. They want to know more about what's going on right now, what's the future for them. So this person, Emmanuel Asante, says, as public health students, how can we engage relevant stakeholders in our quest to contributing to the health of community and also to gain community acceptance? Who wants to answer that?
Well, I can start by just saying that there are lots of volunteer opportunities for you to do the outreach through your state or local health department or through a volunteer organization. A lot of the state associations or public health institutes have those volunteer opportunities to engage communities. But, anything in medicine, anything in healthcare, so Red Cross, social services, people that are distributing food for needy populations, any of those kinds of things give you a sense of the mission and really how the social determinants impact the health of populations. Not only do you provide a needed service, but you learn a lot, and you'll be surprised at how that networking over time serves you as you move up in your career. I mean, the number of people that I have met through those volunteer activities where I have been preceptoring students or done it myself, over the years, those folks, they grow up and they move up in their organizations as well. And we have found extraordinary partnerships through the years.
Thank you. Thank you, Dr. Benjamin. So just knowing that we have students in the audience, let's just concentrate a little bit on them, on their world, and what's going on in their minds right now, and ask all of you actually to give this message to the current students, the current pipeline of our next generation of really the workforce. So what message would you want every public health student to hear as they enter the field during such a pivotal time? What would you say?
Let me start with the future is bright. I mean, yeah, you hear about funding cuts, you hear about job losses, but, the future is bright. The health, illness and the need for our work is not going to go away. Infectious diseases are here. People injure themselves. We have enormous health inequity issues. So climate change is a big issue. So the need for you is not going to go away. And while there's going to be a lot of movement around of the jobs and the opportunities, at the end of the day, they're going to still need us and we're still going to be there. So don't be dissuaded by the stories you hear in the newspaper. I put in the link a jobs website. It's a single landing page that all the associations, including ASPPH, ASTO, NACHO, all the groups have come together on a single page, as well as you can go to all our individual websites and find job opportunities there. So I encourage you to do that and celebrate our profession.
Wonderful, thank you.
Yeah, really, really good advice. And I've been having this conversation a lot with our students at the University of Washington. It is a scary and challenging time to be a student. I think most of all for those who are just getting ready to graduate in the next couple of months, or who are looking for practicum projects and are finding that our practice partners are really overwhelmed right now and have really unstable finances. And it's a challenging time. I guess I would offer a couple of pieces of solace and advice. So the first piece of solace is that we, the public health academic side of things, have designed your degree programs not for specific careers in mind, but rather with the skills that you need to be effective change agents to create a healthier future. And it's always been true that our graduates from our programs have gone onto a broad range of careers and careers in different types of organizations and have always moved around a lot. And so I am very confident that the public health degrees that people are getting will provide them with skills that are useful regardless of whether they end up in their dream job at a governmental public health agency, or whether maybe they end up with a job that they didn't even realize existed, like that, Amazon is hiring epidemiologists to do work that used to be in the public sector or didn't exist before and now is in the private sector. And the skills that we and competencies that you've been focusing on acquiring are broadly transferable intentionally across a bunch of different sectors. So that's one that I would say yes, absolutely. It is a scary time. It's going to mean using different approaches to do the job search and broadening your search. But I do agree with Dr. Benjamin that there is such a need for the skills that you have and for public health as a discipline that need is not going to go away. And we want you to be out there in your first job careers, gaining more skills that you'll find necessary when you maybe come back to the governmental sector later in your career. One thing is sure, public health is not going away and things always come back around. So we absolutely know that this is a rough time for you, and are here to support you in that. And you're still chosen a great career.
Wonderful. Well said. Thank you so much, Dean Godwin. Dr. Cantor, something else to add?
Agree 100%. This is a very exciting time to be in public health. Look, I mean, I'm going to make the presumption that we all went into public health to try and make a difference. Um, the time to make a difference is right now.
Mhm.
If you were looking for a boring field to go into, you made the wrong choice. Um, Immense opportunity to make an impact on the entire public health system right now. I think it's a very exciting time to go into it. Um, the job market is going to get better. I have 100% expectation about that, without question. And there's a lot to what Dean Goodwin was mentioning. There's a lot of ways to make good use of public health training outside of what one might consider a traditional public health job. It doesn't have to be in a health department. Hospitals, hospital systems, the corporate world, there are tons of opportunities, and all that experience will help you down the road in your career. The other thing that I've reflected on myself is, I think at earlier stages of my career, I got hung up on, should I go on this track or that track? Should I get a PhD? And those decisions seemed like really weighty, decisions that if I messed up a decision, I was hosed, for the rest of my professional career. In retrospect, what's much more important than that is just getting involved in something that excites you. What I've realized is when you're in a position that you're working on something that you have interest in, that gets you up in the morning, that you're excited about, that you're excited to do a quality job about, one opportunity tends to beget another opportunity, and so forth and so forth. So I would suggest putting a little bit less stress on, what do I do this program? Do I do that? Think about getting involved. Look for things that excite you. Look for subject matter that you really care about. Um, and those will open doors for you that you didn't even anticipate, I think.
Absolutely. Thank you
Laura,
so
can I
much.
jump in
Yeah,
quickly?
please. Yes.
Okay, so 100, if not 1,000%. And I wanted to give a shout out to two of my mentors, Jonathan Fielding and Richard Jackson, who 8 years ago, when we were having very similar conversations about what does this moment mean for public health, came and talked to students at what's now the Fielding School of Public Health, and really emphasized that this sort of like, this is a discipline that like comes and goes, but the need is always there. And exactly what you just pointed out, which is that follow your passions. In this moment, we don't all need to solve all of the problems, but we do as a community collectively need to solve the public health problems. And the best way to do that is for each person to stay focused, not get distracted by all the chaos around us, but stay focused on that part of public health that makes you want to get up and go to work every day.
Wonderful. Thank you so much for those words. I know that we're almost ending our session, but I really would like to touch in another two areas. One is collaboration. You can all see that in this panel, we represent different sectors of our field of academic public health, academia, practice, policy, advocacy. So what would you say is, how can we do more collaboratively, or how can we really foster stronger collaboration between all of us, academia, policy, practice, really in sustainable ways? What would you say?
Well, we obviously have to practice collaboration. We talk a lot about collaboration and partnerships, but it isn't easy. It doesn't come natural. We are solitary beings by our very nature. We're social beings, but organizationally, we're solitary. We get in and we do the work that our organizations require. And so for me, when I'm meeting with my staff, I always ask, okay, who's missing? Who should else be at the table? How can we leverage what we're doing? And as I say, work smarter and not harder. Who's already doing something, so we're not reinventing the wheel, that we're not duplicating what others are doing. And when you approach a problem that way, then you find all kinds of other people that are already kind of doing the work, and that sometimes you can work with them to get much greater impact. but you have to ask that question first.
Thank you. Anything else?
I just would, I know I'm keep giving shout outs, but shout outs to my colleagues at the local health jurisdictions and the Washington State Department of Health. I have to say, the last couple of weeks have been so rough for them. And yet so many of them have reached out to say how much they want to continue to partner with us and say, like, even if I can't be there for this thing, we're going to make this work, or let's make sure that we're planning something else. And so I just feel grateful in this moment of that we are this incredible networked community across public health and across different sectors. Yeah. So, and also appreciative that you brought together this group, Laura. This is a great example of making sure that we're talking to each other.
No, absolutely. And actually, we work together in an everyday basis. And I mean, ASPPH is really grateful and honored to have these distinguished partnerships with our colleagues here, represented here, and many others that are constantly, working hard and tirelessly to really move forward the health of the people. So yeah, this is incredible, and thank you so much for that. So just a last message from each of you, maybe ending in a positive, and I learned this from our chair board, the board of Dean Godwin, that has reminded us the importance of ending our sessions, our meetings, our calls with one positive message, and maybe encourage you to, I mean, you can say anything, but if you can also, or maybe just Dr. Benjamin talk about what's his vision. If I ask you, like, in one phrase, what will be your vision for the next 30 years of this National Public Health Week? What would you say? What's the vision for 2025? Or what's the message to the audience today in one small message? What would you say?
Oh, I would love to be here 30 years from now making a pronouncement that we've achieved optimal health for all.
All right. Yeah.
I'm going to play off of something that Dr. Benjamin said right towards the beginning, which is, I would love for us collectively to think about how next year's National Public Health Week can be even more outward facing to getting the word out about public health. I still want us to be like gathering together and celebrating each other, but that part of that, like, externally facing part of it, to me seems like this is a really great time to have that, to commit to that focus for next year. I'd love to see that.
Excellent.
I would love, if it was 30 years from now, I would love to be able to sit back and reflect on how has public health grown, how has it changed, and more importantly, what has the next generation of public health leaders brought to the table that us older farts haven't even thought of yet. So
Wonderful. Well, thank you all for joining us for this meaningful conversation in celebration of the 30 years of National Public Health Week. I want to extend my deepest thanks to our distinguished panelists, Dr. Georges Benjamin, Dr. Hilary Godwin, Dr. Joseph Cantor, for their real insight, their wisdom, and your continued leadership in advancing the field. So as we heard today, public health has come a long way, from eradicating diseases and extending life expectancy to building healthier, more equitable communities. And yet, the work is far from done. The challenges we face, from climate change to misinformation to workforce resilience, really require bold, collaborative solutions and sustained commitment. At ASPPH, we believe that academic public health plays a critical role in shaping that future. Our schools and programs are not only preparing the next generation of public health professionals, they are also conducting the research and forging the partnerships that will define the future of our field. This webinar has also been a powerful reminder of how vital collaboration is. ASPPH and its members are honored to work alongside partners like APHA, ASHTO, and many others as we collectively pursue a healthier, more just world. I encourage you to carry this momentum forward as we close today's session. Stay engaged, support and mentor future leaders, advocate for strong science-based public health systems, and continue the conversation beyond this week. Your voice, your work, and your leadership are needed more than ever. The road ahead may be tough, but it is also full of possibilities. Together, we can build a healthier, stronger, and more equitable future for all. On behalf of all of us at ASPPH, thank you again for being part of this celebration and for the work you do every day to protect and promote public health. A recording of this presentation will be added to the events landing page later today and emailed to all registered attendees. The landing page is accessible via this QR code. Please visit our ASPPH Presents series landing page for upcoming webinars. We update the page regularly. Thank you again. Stay safe, connected, and engaged. Thank you to all our panelists and audience. Thank you.
All right. Thanks.
Wonderful. Thank you. Thank you
It's great.
so much. It was a great conversation. Thank you all. Have a great afternoon.